Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. School-based feeding program ating pagtibayin. Wastong pagkain ating ihahain, mga batang kulang sa timbang. Ating pakakainin ng Go, Grow, and Glow. Adolescent reproductive health ay gawing gabay at patnubay ng batang mausisa ay di maranasan. Ang early pregnancy ay maiiwasan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. National Drug Education Program or NDE kung tawagin. Ito'y paigtingin, mga bisyo'y alisin. Sigarilyo at droga'y dapat nang puksain. Water sanitation and hygiene in schools ating kompletuhin, 3 stars ay abutin. Malinis na tubig, segregated na toilet, group hand washing at may napkin na rin. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Medical, dental, and nursing services na atin ding binibigay upang matugunan problemang pangkalusugan ng mga guro at kabataan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Okay talaga sa DepEd. Okay talaga sa DepEd.
partner.
Magandang umaga, partner.
Welcome sa OK sa DepEd One Health Week Celebration 2021
na may temang Bayanihan para sa kalusugan.
OK sa DepEd, sa Paaralan at sa Tahanan. We are airing live at Schools Division of Imus City
And we are
fully vaccinated. Sa puntong ito, nais naming pasalamatan ang mga taong nasa likod ng programang ito na patuloy na kumikilos upang maibahagi sa lahat ang bawat programang nakapaloob sa OK sa DepEd.
sa aming iginagalang Dr. Rosemary D. Torres, ang ating Schools Division Superintendent.
Iginagalang Dr. Ivan Brian L. Inductivo, Assistant Schools Division Superintendent.
Sa aming mga Chief Program Supervisors at Education Program Supervisors.
Unit Heads at Section Heads.
School Heads.
Medical Officer, Dentists at Nurses.
Sa ating School Health Program Coordinators at Focal Persons.
At sa mga teaching at non-teaching personnel stakeholders, welcome to this celebration! Sa puntong ito, malugod namin inaanyayahan ng lahat na tumayo at makiisa sa pambansang awit ng Pilipinas na susundan ng panalangin, marcha ng Calabarzon at himno ng Imus via audio-visual presentation.
Mga kababayan, ang pambansang awit ng Pilipinas.
Dear God, kayo po ang pinaka-understanding and pinaka-powerful. Kami po ay nagpapasalamat sa buhay pong binigay niyo po sa amin. Ngayon po ay nagsasama-sama ang mga taong different ang religions. Pero po sincerely po kami nagdadasal upang kami po ay maging united para makuha po namin ang aming goal. Gawin mo po kaming instrument ng love, light, and peace. Gabayan niyo po kami para po masundan namin ang inyong daan sa isang peaceful community at maging source ng happiness and hope sa isa't isa. Wish ko lang po maging nice ang place na ito sa lahat ng tao. Sa inyong kalooban at paggabay, sana po maging tulong ang activity na ito para mag-benefit ng marami. Gawin mo pong ligtas at malayo sa anumang sakit ang bawat isa sa amin. Kasi po scary po ang pandemic. Marami pong salamat, God, at mahal po namin kayo. Amen.
Ang kaunlaran kay bilis
masagana, kay ganda ng kapaligiran. Ang imus mutiyang minamahal, may ningning pag-ibig at dangal, ugad ng lahing sakdal kagitingan. Inang bayani may kadakilaan, tigib sa puso pag-asa't kalayaan. Kapuri-puri imus ating bayan, ang imus mahal kong bayan, sulong sa kaunlaran. Dito'y payapa at masagana, kay ganda ng kapaligiran. Ang imus mutiyang minamahal, may ningning pag-ibig at dangal, ugad ng lahing sakdal kagitingan. Inang bayani may kadakilaan, tigib sa puso pag-asa't kalayaan. Kapuri-puri imus ating bayan, anong ligaya ang dito'y silang. Kapuri-puri mo sa aking bayan, kapuri-puri mo sa aking bayan.
Para sa pambungad na pananalita, malugod naming inaanyayahan ang ina ng Kagawaran ng Edukasyon sa Lungsod ng Imus, Dr. Rosemary D. Torres.
To our very competent Assistant Schools Division Superintendent, Sir Ivan Brian Indactivo, to the pride of School Governance Operation Division, our Chief, Sir Ivan Orpet Mijares, to our very charming, very accommodating and intelligent Medical Officer, Dr. Pauline Aleja, and of course to our very hardworking and at the same time, the pride, of course, of our medical team, Dr. Maripe Grossman, to all our nurses, to all our Bidang Imuseño educators, learners, parents, and other stakeholders who are tuned in at DepEd Imus City social media platforms to witness our significant virtual event today, the Division Celebration of One Health Week with a theme, Bayanihan para sa Kalusugan, okay sa DepEd, sa Paaralan at sa Tahanan. A pleasant and a blessed morning to all of you. As part of Oplan sa Kalusugan sa Department of Education or okay sa DepEd, the Schools Division of Imus City is one with DepEd in showcasing health and nutrition programs and services which are classified into 6 flagship programs. The School-Based Feeding Program, the National Drug Education Program, the Adolescent Reproductive Health Program, the Water Sanitation and Hygiene in Schools or WINS programs, the Medical, Dental, and Nursing Services, including the School Dental Health Care Program and the School Mental Health Program. Today, I am proud to share with you that DepEd Imus City is one of the prime movers in participating in national and regional activities and in spearheading various initiatives and innovation for Bidang Imuseños. In terms of vaccination status, 94.18% or 2,802 of our teaching and non-teaching personnel have already been fully vaccinated, while 1.55% or 46 have received at least their first dose of the vaccine. The vaccination for 12 to 17 years old have also been rolling since last week. And this would not have been possible without the tremendous support given to us by our city government headed by Mayor Emmanuel Maligsi. Dahil sa Imus, bida ang may bakuna. Just last week, we have also received exemplary support services delivered awards from the regional office as SDOIC Imus City and Division Focal Person Nurse Jacqueline Mararak, as well as Governor D.M. Camerino Integrated School, its school head Sir Jesus Bergado and teacher Roger Ian Demilio have all been named finalists as outstanding school-based feeding program implementers. Imus National High School and Sir Arturo Rosaroso, its principal, have also been named finalists in Barkada Contra Droga implementation. In terms of facilities, 2 new school clinics were inaugurated. One in Governor DM Integrated School and another one in Imus Pilot Elementary School. And to top it all, I am pleased to announce that we have already started the pilot implementation of limited face-to-face classes. This is in Governor D.M. Camerino Integrated School. And during the visit of regional officials headed by Dr. Eduardo Zapanta, Dr. Edenia Libranda, and Sir Elino Garcia, they said that we have exceeded more than what is expected. Indeed, given the current situation of the basic education sector, now is the best time for us to convene as one and to strengthen the school-home community partnership in the implementation of programs and initiatives, especially those that ensure and address the health, safety, and well-being of our learners amidst the pandemic. Hindi obligasyon, kundi dedikasyon sa kabila ng sari-saring hamon. Again, a pleasant morning to one and all, and to God be the highest glory.
Thank you so much, Ma'am Rose. Damang-dama po namin ang iyong suporta sa ating kagawaran bilang ina po ng ating dibisyon.
Ngayon naman po ay masaya namin ibinabahagi sa inyo ang 6 na flagship programs na bumubuo sa Oplan Kalusugan sa DepEd.
Simulan po natin yan sa school-based feeding program.
Medical, dental, and nursing services including school dental healthcare program,
Mental health, wash in school program,
adolescent reproductive health at national drug education program. Tunghayan po natin ang Oplan Kalusugan sa DepEd jingle na ito. Let's watch this.
Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. School-based feeding program ating pagtibayin. Wastong pagkain ating ihahain, mga batang kulang sa timbang. Ating pakakainin ng Go, Grow, and Glow. Adolescent reproductive health ay gawing gabay at patnubay ng batang mausisa ay di maranasan. Ang early pregnancy ay maiiwasan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't pagkain magkaisa. Halina tayo sumama. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. National Drug Education Program or NDE kung tawagin. Ito'y paiktinin, mga bisyo'y alisin. Sigarilyo at droga'y dapat nang puksain. Water sanitation and hygiene in schools, ating kompletuhin, 3 stars ay abutin. Malinis na tubig, segregated na toilet, group hand washing at may napkin na rin. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo sumama. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Medical, dental, and nursing services na atin ding binibigay upang matugunan problemang pangkalusugan ng mga guro at kabataan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo sumama. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Okay talaga sa DepEd. Okay talaga sa DepEd.
Ang galing! With all the efforts of Schools Division Office, kasama na ang ating mga school heads, clinic teachers at mga program coordinators ay naipatupad ang bawat programa ng OK sa DepEd sa mga paaralan na umabot sa bawat tahanan. Alam niyo ba, noong last November 5, 2021 ay nagkaroon tayo ng blessing at inauguration sa 2 central clinic. Nabigyan ng DepEd Central Office ang SDOIC Imus City ng 2 Central School Clinic na naglalayong bigyan ng serbisyong medikal at dental ang lahat ng mga mag-aaral, guro at iba pang empleyado ng DepEd. Tunghayan natin ang naganap na blessing at inauguration sa 2 Central School at Clinic sa Governor D.M. Camerino Integrated School at Imus Pilot Elementary School.
Today is the celebration of blessing. Blessing coming from God. Because the miracle that all of us are here today, kumbaga, for a common purpose, for our blessing and inauguration of medical and dental clinic, that's something that we need to be thankful to our Father Almighty. Ibig sabihin, lahat tayo walang sakit, all of us are taking in our life, all of us are definitely with energy, now with great opportunity to serve and to be with our parents.
Patnubayan at patuloy na pangalagaan ng makapangyarihang Diyos, ang Ama, ang Anak, at ang Espiritu Santo. Amen.
Diyos, pagkatapos na likhain niya ang mundo, pagkatapos na likhain niya ang mga tao, ay ginawang katiwala ng Diyos sa mga tao para pangasiwaan at para pangalagaan yung iba niya pang mga nilikha. Santo, sumainyo ang Panginoon. At ito ay isang malaking biyaya para sa ating lahat. Lalo higit tayo bilang mga tao na naglilingkod, tayo mga tao na nagtatrabaho para sa ating sarili at para rin sa mga taong kapaligid sa atin. Ito ay isang malaking biyaya ng Diyos sa atin. At panigurado yung mga ganitong gawain, bawa itong pagpabasbas, itong klinika, pagtatayo ng klinika, ay isang bahagi rin ng ating responsibilidad. Sumainyo ang Panginoon, pagpalain kayong lahat ng makapangyarihang Diyos, Ama, Anak, at Espiritu Santo. God bless you po.
There is an old saying, health is wealth. Stay Staying healthy plays a vital role not only to an adult's life, but to children as well.
Dr. Rosemary D. Torres, for her inspiring thoughts and blessings. Thank you very much once again and good morning.
At nakakatuwa, kayong taga-Imus Pilot Elementary School, very lucky kayo because definitely you were given the best principals. Kukunti lang tayo ngayon pero damang-dama ko po yung init ng inyong kaligayahan, init ng inyong pasasalamat because of the activity that of course ginagawa natin ngayon. Hindi po lahat ng schools were given this kind of blessing na may package pa na napakaganda ng dental clinic.
Ngayong umaga, tunghayan natin ang mga updates tungkol sa telemedicine. Ang telemedicine ay isang innovation na naging platform upang patuloy na maibigay ng mga medical team ang iba't ibang medical services. Kasama natin ngayon ang isang telemedicine doctor from Makati Medical Center Health Hub, an endocrinologist, and a remote doctor for Medgate Philippines. Good morning po sa ating speaker, Dr. Daphne Gail Galang. Let's all listen to her as she discusses more about the updates on telemedicine.
Good day, everyone. I am Daphne Gail Galang, and today I will be talking to you about telemedicine. So I am a telemedicine doctor for Makati Medical Center Health Hub. We optimize telehealth to take care of COVID-19 patients. I am a remote doctor for Medgate Philippines, and I do telemedicine for my private practice as an endocrinologist at Doc Gail Endocrinologist Online. So the objectives for this talk would be to define what is telemedicine, to identify the advantages and disadvantages of telemedicine, to learn to administer a virtual physical examination. Let us start. What is telemedicine? Telemedicine is medical care provided from a distance. It could be done through a video call, through a telephone call, or text messaging, or Facebook Messenger. Doing telemedicine through video calls has many advantages. One would be that you will be able to conduct a virtual physical exam because you can see the patient. You can also see the environment of the patient and get helpful clues regarding factors that contribute to the symptoms of the patient. One disadvantage of doing video calls would be the requirement for good internet connection. There are many Filipinos found in rural areas with poor internet connection, making it hard to consult. Another is that it requires techie apps, and many senior citizens have trouble using technology. Another way of conducting telemedicine is through a telephone call. At least, using this, you do not need an internet. However, the physical examination will be limited and you will rely on what the patient says and not with your own eyes. Text messaging or Facebook Messenger is another option. This is not recommended from a medical legal standpoint. The patient can readily take a screenshot of the conversation and it can be posted through social media. And we all know that can be a lot of trouble. So we really don't recommend this. So why telemedicine? There is a boom in telemedicine because of the COVID-19 pandemic. One is because of its convenience. There is less waiting time for patients. Sometimes doctors in clinics will have long queues for patients, and with telemedicine, patients don't have to wait for 1 hour outside the doctor's clinics anymore. They can just stay at home, do their thing while waiting for the appointment. There would be no transportation costs, no time lost commuting, and there's no need to be absent to have an appointment with a doctor. Next is that there is no risk for infection, and this is why telemedicine is very helpful during the pandemic. It is more flexible, it can reduce the doctor's shortage, provide support for the rural areas. For example, what do I mean by this? For example, in rural areas, there might not be a lot of specialists as they might be found in other areas, concentrated in more urbanized areas in the Philippines. With telemedicine, you can consult with an infectious disease doctor who might be based in Manila, a cardiologist who might be based in Cebu. So telemedicine makes these doctors very accessible. I also placed here that there is a potential for better care. So there is a potential for a better patient and doctor relationship. Since you are at home and you visually welcome the doctor at home, it could mean a more personal care than a clinic consult. I also wrote here more affordable care on the patient side. As I said, less transportation costs, no need to be absent at work when seeing a doctor. So there are patients who have no work, no pay, so they don't have to be absent at work. Now, what are the bad things about telemedicine or the disadvantages of telemedicine? So number one is that assessment could be limited, but I think that we can do things to get more information, and that is what this talk is for. Next would be the privacy issues. For example, you have a patient complaining of rash and it is found in a private area. Now, you really have to protect the privacy of your patient. You have to conduct your telemedicine in a private space and not with many people passing through. And if possible, you have to lock the door, okay? Don't conduct telemedicine while doing the grocery. Don't conduct telemedicine while in the jeepney. Protect patient privacy. Next would be excessive consultation. This is true, especially if you are using platforms where the patient can reach you 24/7. For example, during the start of my practice, I use Facebook Messenger to call patients. And they end up messaging me after 3 days, after 5 days, out of office hours, during a Sunday. Now imagine if you have 10 patients doing that. It can be very overwhelming for the healthcare provider and it can burn you out. So my tip is that do not give out your personal number. There is nothing wrong with that. For emergency cases, we have emergency rooms, okay? Take care of your mental health during this pandemic, okay? Next would be technical. There will be geriatric patients. So geriatric patients who will tell you, Doc, I am not techie. Doc, I don't know how to Zoom. Doc, I don't know how to use Facebook Messenger, so I can't do the consult. This could be a problem. In fact, there are many patients in the older generation who would really want to rather just have a face-to-face consult. So what are the scenarios that make telemedicine so helpful during this pandemic, especially at this time of COVID-19? So number one, if you have a patient with mild respiratory symptoms and needs evaluation, but has been told not to go to the ER. So here especially, we have our ER capacity full, and then if you are a COVID-19 patient who presents with very mild symptoms, the doctor will ask you to go home, ask you to wait, because there are patients requiring more urgent needs. So telemedicine can be done with these patients since they only have mild symptoms, so they can just do their consult through telemedicine. Next would be a patient with COVID-19 exposure, asymptomatic, and wants to see a doctor. So you have this patient who doesn't have any symptoms, COVID-19 positive. He wants to ask you, what are the medications that I have to take, doc? What should I do? Should I be worried about these things? When do I get well? And how do my family members screen for coronavirus? So this patient can be entertained through telemedicine. Now, what if it's the doctor who has been exposed and needs to be quarantined? However, the doctor needs to see patients. Telemedicine can be done. Next would be if you have a hospitalized COVID-19 confirmed patient and needs a specialty consult from a distant healthcare provider. For example, you have a COVID-19 patient in the province and then there is no infectious disease specialist. You can readily consult a specialist through telemedicine. So these are scenarios that make telemedicine very useful at the time of the COVID-19 pandemic. So for the next part of the talk, we will be talking about how to conduct a virtual physical examination. As I said earlier, one of the consequences of telemedicine would be there would be a limited physical examination. But again, we can take measures to optimize that. So when you first see the patient, you have to take the general survey. Does the patient look in distress? Is there any difficulty breathing? Does the patient speak in long sentences? Or does the patient have to cut his sentences in short phrases and the patient has to take a deep breath in between? Now, these are the things that you have to observe. Is the patient breathing very fast? Mukha ba siyang in pain? So, these are very important observations you have to take so that you can triage your patients accordingly. Many patients have pulse oximeters at home. Ask for the oxygen levels. You can also ask for the heart rate. If they have a BP apparatus at home, you can ask for their BP. And you can even ask for their temperature if they have a thermometer at home. These are already must-haves at home, these gadgets. So ask your patient. Maybe your patient has that. The general survey is the perfect opportunity to triage your patient. So if your patient is in distress, if the oxygen levels are lower than 94%, if they have severe pain, do not proceed with a teleconsult. Tell them, I'm so sorry, ma'am, but I don't feel comfortable doing this teleconsult. I think it is best that you go to the ER right now. Okay? It's better safe than to be sorry. For the skin. If the patient has a skin complaint, ask them to take a picture instead of doing a video. At least you can focus on the features of the rash and the patient can take his best shot. Now, by experience, kapag video magalaw, malabo, you cannot focus and then the patient tends to move the video a lot like, doc, here, 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 here. What you really want to see is you want to examine the rash very well. So a picture is best for rash. These are examples of common skin complaints. This is an eczema, and this is the shingles rash. It doesn't cross the midline. It is very painful, and it is very common in the older population or patients who are immunocompromised. The distribution of the rash is also a very important information. If possible, have the patient take the whole picture para makita mo which parts of the body are affected. And if the patient doesn't consent to that, you can just ask the patient to describe the areas affected. For the eye exam, this is very easy. Just look at the eyes, check out if there are lesions. If you want to check on the pupils, have the patient bring on the light one eye, and examine closely. Now, if the patient is complaining of loss of vision or severe eye pain, for example, the patient will tell you, Doc, I feel that my eyeballs are going to explode. Then maybe that patient is better off at the emergency room being seen by a specialist. Now, for the neck exam, for example, if the patient is complaining of neck pain, have the patient palpate the area. If it is tender, if there is anything rolling underneath, ask the patient to hyperextend the neck like that. And then if the patient is complaining of an anterior neck mass, hyperextend the neck, ask the patient to swallow. If the mass moves up during deglutition, during swallowing, maybe it has something to do with the thyroid. Request for a thyroid ultrasound. Also, if the patient is complaining of neck pain, have the patient do range of motion exercises. Later on, I will be showing you the range of motion exercises for the neck. It could be related to their job, prolonged sitting period, especially in office workers, in the bank, or the BPO sectors. Now, there are patients who will complain of throat pain. For throat pain, it's really best to ask them to take a picture again so they can give you their best shot. Now, look at here. So this is a good picture. You can see the posterior pharyngeal wall. You can see that there is no tonsillar enlargement. Compared here, a bad picture, it's blocked by the tongue. You cannot see the tonsils or the posterior pharyngeal wall. So in throat exam, ask them to take a picture. This takes effort, by the way. This is not easy, but ask them to do it anyway. Compared to a video, it's very hard. They keep on moving, and then you keep on say, do it again, do it again. So it's really best to just take a picture. In patients complaining of ear pain, you cannot see the inside of the ear canal because it is very small, unless the patient has a camera at home with lighting that can fit the ear. But what you can do through telemedicine is examine the outer ear. Have the patient palpate it. If it is tender, you can look if there is ear discharge, if there is redness. So those are the things about the ear that you can examine. Now, for the cardiopulmonary exam, it is better to examine the pulmonary part ahead in the general survey because maybe the patient will be better off going to the ER. You can check for accessory muscle use if there are retractions. Ask the patient to inhale and then exhale forcefully like that. So in patients with COVID-19, when they inhale very deeply, they end up coughing. So that's something you can do to check if the lungs are okay. Now, for the cardiac exam, it is very hard to examine the heart, but maybe you can do without it. Unless we are looking for arrhythmias, how often do we really hear murmurs? How often do we really hear S3? How often do we really observe a displaced apex beat? So maybe we can do without a cardiac exam. If the patient has a BP app, ask the patient to take it for you. You can also check for distended neck veins. Look for signs of heart failure. Ask the patient to check the legs for edema. For the abdominal exam, there are those who complain of abdominal pain. What you should do is you should ask them to stick out their index finger and using that finger, point out the location of the abdominal pain. The location of the abdominal pain can tell us the cause. It can give us a lot of information about the cause. Pain in the epigastric area, if it is here, can be due to these conditions. Can be due to hyperacidity, GERD, or an ulcer. Pain in the right lower quadrant can be caused by acute appendicitis or something to do with the ovulation, the Mittelschmerz, or something to do with the ovaries. For example, ask your patient, could there be any possibility of an ectopic pregnancy, urinary tract infection? Ask the patient to palpate the area. Ask the patient to press it if it is painful. And then which one is worse? If you press it hard or when you release? If there is more pain during release of the pressure, it might signal an acute abdomen. Sometimes you can judge acute abdomen by just the face of the patient. If the patient is smiling, laughing, and relaxed, it might not be an acute abdomen. But if the patient is very sick, looks pale, looks in pain, you better advise them to go to the ER. If you are not sure, advise them to go to the ER anyway. Always remember that always tell your patient that if the pain does not go away despite the medications that you prescribe, go to the doctor, go to the ER. For the musculoskeletal exam, during the pandemic, many teachers will complain of muscle pain. A lot of teachers spend a lot of time sitting down doing their lesson plan. And there are also those conducting virtual classes, spending hours and hours in front of the computer. It'll take a toll on their neck and their back. So this is a very important part of the physical examination, especially for teachers. So you can see here a patient complaining of foot pain. Now ask the patient to move the joint. Ask the patient to walk. Is it painful? Can the patient still walk? As you can see here, ask the patient to press. Lumulubog ba ang finger? Does it look swollen, maga? So this could be gout or septic arthritis. Ask the patient also of their pre-existing illness. Baka naman matagal na silang may mataas na uric acid and this is an acute attack of gout. Now, if they complain of neck pain, ask them to do the range of motion exercises. Go up, down, to the sides, and then to the side, and to the side. A lot of them would have arthritis of the neck or cervical spondylosis. And it would really help to interrupt every 30 minutes of sitting down by standing up for 5 minutes to help relax the neck muscles. Those complaining of shoulder pain, ask them also to do the range of motion exercises for the shoulders. Have them raise their shoulders to the sides and up, extend the hands to the front and then to the back. Ask them to try to extend their hand to the back like this, like trying to unhook their bra. And then let the left arm reach the right arm like this, and then vice versa also to check the entire range of motion for the shoulders. Now, a lot of teachers will also complain of low back pain, again, from sitting long hours. Doc, masakit ang likod ko, dito, dito. So, it's important that we do a sensory and motor exam. For the motor exam, first we check for L4. So here in the picture, there is a doctor. You can't do that. Remember, this is a teleconsult. So the patient is alone. So ask the patient to kick hard. That's to test for L4 strength. Okay? Let the patient bend the knee and then kick out. Now ask them if they have a hard time doing this. Next, also ask the patient to walk on their heels. So ask them to walk on their heels while you watch. And then to test for S1, let the patient walk on their toes. So this is how to do a motor exam for low back pain. Also do a sensory exam. So using the patient's finger or any other light object, test for these nerve roots to test for L4. Try to check if the sensation is good in the lateral thigh, so sa side ng thigh, anterior knee sa harap, and then also the medial instep, okay? For L5, test the middle space between the big toe and then the next toe. So try to test the sensation here if okay. For S1, check the lateral foot, no, as seen here in the picture. So check the lateral foot if the sensation is okay. Now, it is important to do these tests because if these are all normal, the management will be just to give pain medications, advise lifestyle changes, especially posture and then habits in the workplace, taking frequent breaks, not sitting for too long, get a better chair that supports the back. However, if any of these tests are abnormal, you found either a motor or a sensory abnormality, the patient might need an MRI of the back and a specialty consult with an ortho doctor, with a spine doctor. So the orthopedic doctor. Next, there are certain situations wherein you have to conduct a neurological exam. So for example, you have a patient na natumba, hit her head, or a patient who has a very elevated blood pressure. And before bringing down the blood pressure, you have to take the neuro exam, making sure that you're not dealing with a stroke. So these are the cranial nerves. This is how to test for the cranial nerves. For the cranial nerve 1, it is rarely tested. This is the olfactory nerve. Just ask the patient if he can smell. For cranial nerve 2, the visual field test, ask the patient to read the sentence, cover the left eye, ask the patient to read the sentence again, cover the right eye, ask the patient to read it. So if the visual fields are okay, so cranial nerve 2 is intact. For cranial nerves 3, 4, and 6, these are testing the extraocular muscles. So ask the patient to move the eyes, move the eye, look up, look down, look to the side right, look to the left up, and then also diagonally. Ask the patient to look lateral up, lateral down, lateral up, lateral down. Okay, so these are your extraocular muscles. For the cranial nerve 5, test for the sensation on the face. So ask the patient to touch the face. If the patient is experiencing numbness, nangangapal, or there is a different sensation on the face. For cranial nerve 7, ask the patient to smile, like here in the picture. Ask the patient to raise the eyebrows, if the patient can do it. Ask the patient to puff cheeks. Or close the eyes like this in the picture. So that's the facial nerve. For cranial nerve 8, that's hearing. So if the patient can hear you, so far for the teleconsult, sumasagot naman siya ng maayos, you can assume that the patient is hearing you, and the cranial nerve 8 is intact. For the cranial nerve 9 and 10, ask the patient to say, ah, and then if the palate elevates, so it's intact. For cranial nerve 11, ask the patient to shrug the shoulders like this, so it's intact. For the cranial nerve 12, ask the patient to stick out the tongue. So if the tongue is in the midline, then cranial nerve 12 is intact. So here you can see that the tongue is deviating to the right, okay? So it might be dealing with a stroke. So you better have the patient go to the ER to have a CT scan done. Now that is just the cranial nerves. You also have to test for the muscles. So in the clinic, we test for the muscles 1 to 5. So we test for the strength of the muscles. We have them move against resistance. So for the teleconsult, you can ask the patient to raise the arm and hold it for 5 seconds. So you have a 5-second arm raise. If the patient has an object nearby, you can ask him to grip it and see how strong the grip is to check for leg muscle strength. You can ask the patient to do jump squat. Be careful ha, if the patient is very old and you try to do this at home, baka naman matumba siya. That's more trouble. So ask the patient to jump squat and then see how strong the leg muscles of the patients are. And then this is another maneuver that we can do. This is what we call the pronator drift. So what you ask the patient is put the arms out, palms facing up, and ask the patient to close the eyes. You can see that the weaker arm, it will deviate, no? It cannot sustain this position. It will start to rotate. So that's what we call the pronator drift. So this is the weaker muscle. So it tends to rotate. So these are just more tips. Oh, sorry. So these are just more tips for telemedicine to make your telemedicine more efficient. Number one is the background. So you can choose a wall. So unlike my background, I have no wall. It's better to choose a plain wall rather than distract the patient. Sometimes kasi if your background is very busy, may mga kalat, the patient gets distracted and looks at that, no? So choose a wall. A plain wall would be very good. If you want to be in front of a painting, that's also very good. Next would be to style yourself. As a doctor, it's very easy, just wear a white coat, no? Para ma-feel naman ng patient that he's talking to a doctor. So just wear a white coat. Just because you're at home doesn't mean you should be dressing loosely. So wear makeup, make yourself presentable. Hindi dapat nakapambahay clothes, no? Try to look professional. Use a chair. Don't use a bed or a couch to sit on. So again, para may vibes that you're in the clinic, and then it will also allow information sharing for the patient's part. Next would be invest on a good audio. So if you have really bad audio, sometimes it's difficult to hear a patient, and it's also very difficult to convey information to a patient. So a good audio is an investment. Next would be to pay attention to lighting. Now, the best lighting would be beside a window. So the natural light can come in and the room is brightly lit. So pay attention to your lighting. During the nighttime, you can also have artificial light. So they are already selling a lot of vanity light, teleconsult light. So try to buy that one. I have one here, and then I have here my light also. And then another helpful tip would be to look at the camera and try to make eye contact first with the patient. So sometimes the camera is here and the patient, you can see the patient here below your screen. So try not to look at the screen first and try to look at the camera and establish eye contact with the patient. So that it feels like you are listening intently to the patient. So that is another tip to make a successful teleconsult. So thank you very much. I think so that's it. I hope you learned a lot from my talk, and then good luck to you all for all your teleconsults. So if you have any questions, you can just email me and I will answer them if I have any time. If I have time, okay? During my free time. Thank you very much for your kind attention.
Thank you so much, Dr. Daphne Gail Galang. And I hope lahat ay naliwanagan sa isa sa mga pamamaraan ng pagkonsulta ngayon sa panahon ng pandemya, ang online teleconsult. So let's proceed sa ating second lecture, and this time it will be coming from the Regional Oral Health Program Manager of the Department of Health Center for Health and Development, Region 4A. She will discuss about the updates on teledentistry. Ladies and gentlemen, it's my honor to call in our speaker for this topic, no less than Dr. Edwina J. Go.
Good afternoon. I am Dr. Edwina J. Go,
the Regional Oral Health Program Manager of DOH Center for Health Development 4A. Today, I'm going to present to you the OHIDOC Teledentistry Project. So in 2020, there was a proclamation number 922 declaring a state of public health emergency, and proclamation number 929 placing the entire Luzon under enhanced community quarantine. The RA 11469 placed the entire country in a state of national emergency. So the Center for Health Development 4A unit conducted teledentistry to provide oral health needs to the hard-to-reach, far-flung areas, as well as those in need of oral health emergencies. We call this the OHIDOC, which stands for the Oral Health Initiative for Dental Online Consultation. So we are on Facebook page, and they have to look for the OHIDOC Teledentistry Project. So the background is to provide oral health dental consultations through a social dental application. The teledentistry platform aims to provide direct and immediate access to oral health consultation services using the social media such as the Facebook page, to enable patients to receive oral health services even while staying at home, except for serious conditions, emergencies, or to avail of COVID-19 related health services as per standing protocols. The OHIDOC Teledentistry Project in Calabarzon aims to achieve the following specific objectives. One is to provide oral dental health consultation of licensed dentists to the communities of Calabarzon, especially those belonging to the geographically isolated and disadvantaged areas. Second is to alleviate and minimize risks posed by unnecessary patient traffic in health facilities and avoid COVID-19 transmission at the facilities. Third is to conserve travel time and cost, including waiting time at the facilities while they can access the consultation services in the comfort of their homes. Fourth is to ensure efficient, safe, and secure use of teledentistry by regional, provincial, city, and municipal. Fifth is to support the implementation of community quarantine by staying at home and availing of the teledentistry platform. Six is to document the provided teledentistry consultation services that shall assist in referral, endorsement, and continuity of oral care. Seven is to connect with HIDO, the Health Accessibility and Innovation Development Unit, for inclusion and merging of OHIDOC Teledentistry Project with the HIDOC Telemedicine Project. All patients seeking oral health consultation and treatment during the COVID-19 health situation, especially oral health emergencies. All public and private regional, provincial, city, and municipal level oral health care providers will attend to all patients who seek teledentistry consultation. The OHIDOC Teledentistry Project works by utilizing a live video where a patient can access to the licensed dentist in the area. The dentist can talk to the patients in real time and can give oral health advice as well as first aid home remedy. The use of mobile oral health can be accessed by posting the mobile numbers of the dentist. The Facebook page can also be accessed by the patients of Calabarzon. This will be done during office hours, Mondays to Fridays from 8 a.m. to 5 p.m. We have the Facebook page, and they can look for the Oral Health Unit DOH CHD Calabarzon, and they can find the OHIDOC Teledentistry Project of Calabarzon. So we also have several infographics, and these are some of the examples. So there will be 7 regional dentists and 6 provincial dentists to attend to all the oral health teledentistry consultation at the region and at the province. The city and municipal dentists can also attend to the need of the patients in their area of jurisdiction. They can refer the patient to the provincial dentist assigned on duty. Maximum of 10 patients will be attended per day per dentist. Registration, triaging, and informed consent shall be done online using a link at the Facebook page. And this is the Tagalog version of how the consultation is done. The patients can message privately to the dentist on duty to proceed with the teleconsultation. The city and municipal dentist will attend to the teleconsultation on the oral health by providing the mobile numbers to the patients. All information shall be recorded using the individual treatment record, the ITR, and later transferred to the Electronic Field Health Services Information System, or the FHSIS. The project is limited to primary health care, outpatient services, and what can be done via remote instruction to the patients. And we're going to watch a short video on the 7 step-by-step procedure of the OHIDOC.
Hello and welcome to OHIDOC.
What is OHIDOC?
It means Oral Health Access Innovation of Dentist offering online consultation.
Get the link at FB page of OHIDOC Teledentistry for registration. You can also get the link at the health centers, hospitals and nearest health facilities. Dentists in your area will post link in every designated place, clinic or hospitals that will automatically go through our webpage. Oral Health Unit, DOH CHD Calabarzon. All patients seeking consultation will register using the link provided and click submit so that it will be prompted to our webpage at Facebook. The regional dentist on duty will check the record as to what province the patient came from.
Hello. I am from Laguna. I need help.
Good day. I am Dr. O, a regional dentist.
Hi. This is the provincial dentist.
Hi. How can I help? This is the municipal dentist.
In case where there is no dentist on duty, the regional dentist will conduct the teleconsultation. The dentist on duty will call the patient for his or her schedule of the consultation. Prior to the consultation, the dentist on duty will inform the patient on the OHIDOC Teledentistry project of Calabarzon. He or she will examine the signed informed consent of the patient and can proceed with the real-time or live video with the patient. The dentist will assure the patient's confidentiality, privacy, and data integrity are not compromised. After the consultation, if the patient needs prescription, the dentist on duty will write a prescription, take a picture, and send it to the patient. All dentists on duty attending to each patient shall keep records of all clinical consultation, and summaries using the individual patient record, and shall be encoded via electronic FHSIS. In case there are emergencies that need special care or surgery, the dentist on duty will refer the patient to the nearest hospital. The dentist shall issue a referral form to the patient via web imaging.
Teledentistry project is one platform that can be used to reach all individuals who seek oral health needs.
So that's the short video of the step-by-step procedure of the OHI doc. So this is the individual patient treatment record. This is an official record of DOH. So verbal consent, waiver, or online informed consent and response shall be obtained from the patient prior to the consultation service. Google Doc form for informed consent shall be used by all patients who register, and the use of the Data Privacy Act of 2012 shall be observed also. Patients shall also be advised that capturing of photos or screenshots shall be limited to their personal use for the protection of our dentist under the Revised Penal Code Act number 3815 and the Cybercrime Prevention Act of 2012 RA 10175. So this is our oral health consent form. We have the COVID risk assessment, the oral diagnosis, oral health education, and we have the privacy policy attached to the consent. So this is the form for those patients who cannot access the Google Docs. Then we have the prescription. So the registration and consultation procedures are posted in the social media application, the Facebook page. The regional dentist shall respond to the registration made by the patients via private message for their online schedule. Triaging shall be made by the regional, provincial, city, municipal dentist on duty. Maximum of 10 patients shall be accommodated and catered per dentist per day on duty. Regional dentist may also refer the consultation to the provincial dentist on duty where that patient resides. The public health dentist may also refer the patients to the nearest municipality or city where the patients or caregiver resides. And patients in line shall be prompted that line is open for communication, and they also have to answer the patient's consent Google Docs form before the consultation. The dentist on duty will brief the patient about the OHI doc teledentistry procedure, such as consultation will be conducted via social media, the audio and or video consultation with the dentist. Prescription and referral forms will be filled out by the dentist on duty. It will be scanned or photographed and sent to the patients using the same communication platform as a private message. The e-prescription shall adhere to FDA Circular Number 2020-007, the guidelines in the implementation, the use of electronic means of prescription of drugs for the benefit of individuals vulnerable to COVID-19. The dentist on duty shall discuss the prescription to the patient, ask for any questions or additional concerns. Then once the teledentistry is done, the dentist shall log the patient's entry in the FHSIS oral health forms for endorsement. During monitoring and evaluation, the regional dentist shall regularly undertake monitoring and evaluation activities to assess the quality of implementation, including adequacy of control mechanism to ensure confidence and acceptance of OHIDOC teledentistry by the public health dentist and those in authority. Outcome measures for safety, effectiveness, efficiency, and quality of care. The performance measures such as access, functionality, quality, and cost of service, as well as the operational measures such as acceptability, provider satisfaction, and patient satisfaction. So the services delivered via teledentistry shall be consistent with in-person services, and the delivery of oral health services utilizing these modalities or platform must abide by the DOH memo number 2020-0327, as well as addressing privacy and security of a patient's dental medical information. The treatment of patients who receive services via teledentistry must be properly documented and shall be included, providing the patient with a summary of services. Dentists who deliver services using the teledentistry must establish protocols for appropriate referrals when necessary. So I'm going to show you some of our strategies for the OHIDOC teledentistry. So this is the enhancing smiles across the miles. So we wanted to reach everyone in the barangay for good oral health. The CHD4A, Calabarzon, conducted oral health activities in far-flung and hard-to-reach areas to provide essential health services to the families at the barangays. So the oral health and self-care remain to be high priority in prevention and control of oral problems and conditions. The oral health program promotes oral health activities designed to encourage good oral health practices and increase awareness of the importance of oral health and preventive care even during COVID-19 pandemic. The public health dentists are instruments in making this goal a reality. We at the CHD4A shall provide the essential oral health services to areas with low to moderate risk of COVID-19, as well as the use of teledentistry that aims to provide direct and immediate access to oral health consultation services using the social media. So this is the Department Memorandum 2020-0327 of the Department of Health. This is the interim guidelines on the management of patient and delivery of oral health services during the coronavirus disease 2019 pandemic. This will be the basis for the implementation of the oral health program. So we also use the WHO interim guidance on the considerations for the provision of essential oral health services in the context of COVID-19. This will also be used as the justification. And also, we support the implementation of BIDA at the community by observing the standard protocol. All public and private, regional, provincial, city, and municipal level oral health care providers will attend to all patients seeking oral health services at the barangay. And the LGU dentist shall innovate oral health activities in their area of jurisdiction and augment supplies and materials for the implementation of the oral health program. The use of mobile dental vehicle should be available with standard minimum infection prevention control measures shall be observed. So prior to the oral health activities at the barangay, social preparation and identification of areas where the activity should be conducted. So the routine non-urgent oral health care shall be delayed until there has been sufficient reduction in COVID-19 transmission. The same applies for aesthetic dental treatments. I'm going to show you a short video of Police Lieutenant Edwina Bernadette Gomalonso on the urgent and emergency oral health care.
Maupay nga aga, ano-ano nga ba yung mga dental emergencies? In these trying times of COVID-19 pandemic, sadyang mahirap talaga ang maghanap ng bukas ng mga dental clinics. Ito ay sa kadahilanang high risk ang isang dentista sa pagtitreat ng mga dental concerns. Gayunpaman, may iba't ibang ways naman kung paano kami makakatulong sa inyo. Merong tinatawag na teledentistry or yung online consultation. At katulad nito, nagbibigay kami ng infographics kung paano nga ba masosolusyonan yung mga dental emergencies. Una, gum bleeding that doesn't stop or yung lubhang pagdurugo ng ating mga gilagid. Pangalawa, severe tooth pain or yung lubhang masakit na mga ngipin. Pangatlo, painful swelling or yung lubhang pamamaga ng ating mga gilagid. Pang-apat, chipped off, broken down, or yung tinatawag na knocked out tooth or pagkabasag ng ating mga ngipin. Ano-ano nga ba yung mga dapat gawin? Una, katulad ng sinasabi ko kanina, na lubhang pagdurugo ng ating mga gilagid. Kumuha ng gasa or gauze. I-apply yung gasa doon sa dumurugong gilagid. Lagyan ito ng pressure or pagkadiin. Matapos ang ilang sandali at kapag humupa na yung pagdurugo, pwede nyo rin naman itong lagyan ng yelo. Pwede rin kayo magmumog ng mouthwash. Siguraduhin din na yung mouthwash na gagamitin ay may ingredient na chlorhexidine at hydrogen peroxide. Ito ay makakatulong para humupa yung pagdurugo at maiwasan ang posibleng infeksyon. Kung wala naman kayong mouthwash, pwede rin naman yung warm saline solution. Ano nga ba yun? Yung warm saline solution, yun yung maligamgam na tubig na may asin. Kumuha lamang ng konting amount ng warm water at lagyan ito ng pinch of salt. Makakatulong ito upang ma-reduce yung pagkalat ng bakterya at sa healing process. Bukod doon, kung ang ginagamit ninyong sipilyo ay yung hard bristle, mangyari lamang palitan na ito. Ano nga ba yung dapat? Yun ay ang tinatawag na soft bristle. Gamit ang soft bristle toothbrush, dahan-dahan lamang magsipilyo. Iwasan muna ang malalansang pagkain para makaiwas sa posibleng pagka-irritate nung bleeding gums or yung gums na may sugat. Kapag kasi ito ay na-irritate, posible ang pamamaga. Kung sakali man na hindi talaga huminto ang pagdurugo, mangyari lamang na tumawag na sa inyong dentista. Para naman doon sa knockout tooth or aksidenteng pagkatanggal ng ngipin, ano nga ba yung dapat nating gawin? Kung narumihan yung natanggal ng ngipin, pulutin lamang ito at hanggat maaari, ibabad ito or hugasan gamit ang gatas or saline solution. Iwasan itong hugasan gamit ang tubig. Pagkatapos nito, kung kaya ninyong ibalik yung ngipin doon sa bibig, posible ninyong gawin. Pero kung hindi naman, ibabad yung ngipin sa gatas at pumunta agad sa pinakamalapit na dentista. Kapag naman baby tooth, ang aksidenteng natanggal, hindi na natin ito kailangang ibalik. Dahil hindi magtatagal, tutubo lang din naman yung mga permanent teeth. Kung sakali naman na yung ngipin nyo ay nag-chipped off or yung naputol or nabasag, pwede itong i-restore or yung tinatawag na pagpasta. Kung sakali man na masyadong malaki, gagawa yung dentista ninyo ng treatment plan para ma-save pa din yung buong ngipin. Doon naman po para sa masakit at namamagang mga gilagid at nagiging sanhi ng hirap sa pagnguya at pagkain, mangyari lamang po na tumawag agad sa inyong mga dentista. Kailangan kasi nito ng agarang tulong at medication. Lagi po nating tatandaan na huwag po tayong magse-self-medicate or magse-self-prescribe at hayaan po natin ang ating mga dentista ang mag-prescribe sa atin kung ano ang dapat nating inumin. Dahil hindi po basta-basta ang pag-inom ng mga gamot. Ang mga gamot po ay may iba't ibang klase. Hindi po lahat ng mga gamot pare-parehas. May specific purpose po ang bawat isa doon. So sa susunod po, na sumakit ang ating mga ngipin or kung ano pa mang mga dental concerns, mangyari lamang na kumonsulta sa inyong mga dentista. Sa ngalan ng PNP, PNP Health Service, PNP Dental, in partnership with DOH Calabarzon, Center for Health Development, marami pong salamat.
Okay, thank you very much. So on behalf of our regional director, Dr. Eduardo C. Hanairo, I would like to thank you for supporting the teledentistry project.
Thank you very much po sa ating second speaker ngayong umaga, ang updates on teledentistry.
So hindi lang telemedicine ang meron tayo ngayon, pati sa teledentistry. Maraming salamat po, Dr. Edwina J. Go, Regional Oral Health Program Manager of the Department of Health, Center for Health and Development, Region 4A.
Alam mo ba, partner, na ang ating dibisyon ay may katumbas ding mga teleconsultations?
Uy, maganda yan!
Ito ang SDOIC Telehealth na naglalayong matugunan ang mga medical and dental concerns ng lahat ng personals and learners ng ating dibisyon.
You can see the link kung saan pwede itong ma-access, partner.
You just type tinyurl.com/SDOIC Telehealth. Para sa pagpapatuloy ng ating webinar, tunghayan naman natin ngayon ang isa pang lecture na mahalagang malaman during emergency situation. Dahil maaari naman natin itong magamit kahit nasa trabaho, eskwela o sa ating tahanan, lalong-lalo na ngayong panahon ng pandemya.
Ang ating speaker ay ang Aid Program Manager of Violence and Injury Prevention Program of the Department of Health, Dr. Ann Isabel Gonzalez Andres, na magbabahagi sa atin ng training for first aid. Good morning po sa ating speaker.
So, good afternoon po sa lahat. Ako po si Dr. Waiza Andres, ang Program Manager po ng Violence and Injury Prevention Program ng Department of Health. So ako po ang mag-share sa inyo ng tips on how to prevent injuries at home at mga first aid treatments po. So ito po ang ating outline. So very basic, very common. Ito po yung madalas nating nakikita sa araw-araw. So dito lang po muna ako nag-dwell. Huwag na tayo sa mga komplikadong bagay. So, hand washing, napakagasgas na nito, no? Paulit-ulit sinasabi para daw po matandaan, no? Kasi napakasimple niyang gawin and yet very malaki yung impact niya. So, hand washing is the single most important behavior that can help prevent spread of infection. So, kailangan alam po natin ang tamang hand washing technique. So, kailangan din po free ang ating mga kamay sa relo, sa mga singsing, sa mga bracelets. So, alam ko po ang mga teenagers natin medyo mahihilig sa mga borloloy. So, ngayong may pandemic tayo, ang less ay mas maganda. So, katulad ko po, naghikaw lang ako para magmukha akong babae. Pero wala po akong singsing, relo, ganyan, bracelet. Kasi mabilis kapitan na mga viruses and bacteria. So, clean hands, save lives. So, points to remember in hand washing po, kailangan at least minimum of 15 to 20 seconds. So, kailangan medyo matagal. Alam ko na madalas ginagawa natin pagka nasa CR, hugas lang na kamay, basa ng tubig, pagpag, tapos ipupunas pa sa damit. So at least daw mga 15 to 20 seconds. Tapos, pwede din, gagamit po tayo ng sabon at tubig. So yung step po niya, yung kamay natin, lalagyan natin, babasahin muna natin with soap and water. So ganyan. Tapos po, i-rub natin siya. So from left and right. So, pag ganun po, scrub. After po niyan, is yung palm to palm. So, ito po yung ating palm. Ganyan. Interlacing the fingers po. Yung opposing, i-interlock po natin yung ating mga kamay, and then we do this po. Opposing fingers and interlocking them. So, rub. So, what you do on the right side, you do on the left side din po. The next step po is yung ika-clasp natin ng thumb natin. Ganyan. So, ganyan po ang ating pag-scrub. Siyempre sa other side. And then, para po malinis yung ating mga fingertips, so yung ating palad, ganun. Yan. So, ito po yung, again, yung hand washing natin. Na step by step. Ayan. So, ito po yung next topic natin, which is the nose bleeding. Ayan. So, ang nosebleed po, it occurs when a small vein along the lining of the nose bursts. So, this may be treated at home. So, ang ilong po kasi natin ay very sensitive. So, napakanipis lang po ng lining ng mga ilong natin, konting sagi, mabilis pong pumutok yung mga ugat niya. So, ano ba ang most common causes ng nose bleeding? So, first, syempre, yung common, injury or trauma, nasapak, na suntok, na siko, nataljakan, ano po, no? So, yung mga ganoong bagay po, yun po yung pinaka-common natin. Secondly po, baka naman may sakit yung pasyente, may medical condition siya, kaya dumugo yung ilong. So, most common is dengue, no? Pero syempre, walang tatalo pa rin po sa ating injuries, no? And then, extreme temperatures, so pag nagbago po ng temperature, kadalasan pag sobrang init, doon po, nagdudugo yung ilong. So, may mga tao na very sensitive ang ilong nila. Ako, hindi. Kasi panguyata ako, kaya hindi sensitive ang ilong. Joke lang po. No? So, anong gagawin natin kapag dumugo ang ilong ng isang estudyante, ng kaklase natin, ng anak po natin, ano? So, unang-una, ang number 1 rule ko sa mga what to do is to stay calm. So, kalma lang tayo, no? Paupuin natin siya, tapos, yung ulo, naka-lean forward. Kagaya po ng nakikita ninyo dito sa picture, so naka-lean forward po siya. Di ba ang kadalasang pinapagawa ng mga ng mga teacher, itaas mo yung ulo mo, ganito, no? So mali po yan, hindi po itataas. So magli-lean forward tayo. Kasi pag tinaas yung ulong ganoon, yung blood, nalulunok niya lang, lalo siyang naiirita. So pag nag-lean forward tayo, yung by gravity, pag ganyan ang baba. Hindi papunta dito sa ating lalamunan. No? At diinan daw po yung sa ilong. So, hindi natin pipindutin sa buto. Kasi pag sa buto natin pinindot, wala tayong malalagay na pressure dyan. Buto na nga yan. Pipindutin po natin, diba, from the bone, kapain nyo yung mga ilong ninyo, from the bone, tapos yung baba lang pong portion, yung medyo malambot. So, kapag pinindot natin, malamang ang ilong natin, hindi tayo makakahinga sa ilong. So, hihinga tayo sa bibig. So, breathe through your mouth. And then, kadalasan po, kapag nag-apply na tayo ng pressure, pag pinindot na natin yung ilong, nagsastop na yung nose bleeding. Pero what we could also do po is to put an ice pack or ng yelo dito po sa ating nose bridge or dito po sa ating noo. So, sabi daw po, kapag nag-stop na yung bleeding, huwag na nating kalikutin yung ilong. So, don't rub, blow, or pick nose after the bleeding stops. Kung sakali po na nag-apply na tayo ng pressure or naglagay na po tayo ng ice pack at tuloy-tuloy pa rin na dumudugo yung ilong ng isang estudyante, dalhin na po natin siya sa isang healthcare facility. Third po ay ang mga insect bites. So, very, very, very common po ito. So, ang insect bite, natural, una may kita natin, may kumagat. So, may stinger na present. Pwedeng siyang magkaroon ng pain, na sakit. Pwedeng mamaga, may swelling. Pwedeng may pangangate, itchiness, rash, redness, pamumula, hives or wheals, or it could even lead to death kapag severe allergic reactions. Kapag sobrang, kunwari nakagat ng insekto ang isang pasyente, tas sobrang dami, talagang nag-allergy siya, severe allergic reactions, pwede po na mahirapan na siyang huminga, yun po yung anaphylactic shock na tinatawag, at it could lead to death. No? So kung mga simpleng kagat lang, katulad po nitong mga nasa picture, ayan. So unang rule natin, 'di ba? Number 1 is to stay calm. So sana po kung may kuha kayo kahit isang bagay lang dito sa aking lecture is yung maging kalmado. So kalma lang tayo para kapag kalmado yung isip natin, nakakapag-isip tayo, nakakapag-desisyon tayo ng tama. So number 1 po is to stay calm. Pangalawa, tanggalin natin yung nag-cause ng kagat. Remove the stinger. So wag daw po nating pisilin yung stinger. So wag nating pisilin ng ating kamay kasi po pwede na tayo mismo magkaroon din. So baka mas malagyan din tayo, mag-allergy din tayo, no? So tanggalin na natin. Pwedeng ibang bagay yung gamitin natin to brush off, no? Yung insekto na nag-cause ng kagat. Yon. Tapos kung nasa bahay naman po tayo, at accessible naman ang tubig at ang sabon, ito yung susunod nating gawin. Wash natin. Wash natin with soap and then running water. So, wash natin maigi. After natin i-wash, tuyuin na, pwede tayo maglagay ng cold compress ng yelo po para daw mabawasan yung pangangati at yung pamamaga. Ngayon, kung sa bahay naman natin ay meron tayong available na mga ointments at creams such as hydrocortisone cream or yung calamine lotion po, pwede natin siyang pahiran. Pero kung wala po, okay lang naman na yung yelo. Mas maganda po sana kung meron tayong cream sa bahay. Ngayon, tingnan natin, dumadami ba siya? Kagaya nito pong nasa picture na ito. Usually, yung ganyan, nagsisimula lang sa maliit na portion, tapos bigla siyang dadami. So, observe natin yung patient. Dumami ba? Pag dumami po ng ganyan, that's the time na baka po pwede na natin siyang dalhin sa isang health facility kasi baka magkaroon siya ng severe allergic reactions. So, ayun po. Pero kung mga simpleng kagat lang, okay lang naman na yung calamine and hydrocortisone cream. Okay. So, next po is animal bite. Kadalasan, ang bahay ng isang Pilipino ay mayroong alaga. So, most common ay ang aso, tapos pusa, no? So, yan ang kadalasang meron tayo sa bahay. So, ano ba ang rabies? So, ang rabies ay isang virus na nakukuha siya mula sa kagat, kalmot. So, kahit kalmot po, pwede tayong magkaroon ng rabies at pagdila, no, nung isang infected na hayop sa ating balat. So, paano natin po protektahan yung ating sarili from rabies? So, dalawa yan. Una, pag nakagat ka ng hayop, ng aso or ng pusa, kahit alaga mo or hindi, magpabakuna tayo ng anti-rabies. Pangalawa, pabakunahan din po yung ating mga alagang hayop. No? So, kunwari po, nakagat tayo, ano ang dapat nating gawin? So, ano yung number 1 rule ko? Kalma lang. So, kalma lang tayo. Pangalawa, hugasan. Hugasan ng sabon, tubig. As in talagang wash na wash, no? Yung area na nakagat. So, after nating hugasan, pwede po nating lagyan ng alcohol or ng betadine, no? Tapos, agad po tayong pupunta sa Animal Bite Treatment Center. Ito po yung ABTC na tinatawag. So, may mga health center po na Animal Bite Center din sila na nakapagbigay sila ng bakuna for rabies. No? So, ang isang kagat ng hayop, kagaya po ng kagat ng aso at kagat ng pusa, ay isang emergency. So, kailangan madala natin siya agad kung kailan yung araw na nakagat siya kailangan that day din po ay mabigyan siya ng bakuna. So wag na natin ipagpasawalang bahala or ipagpabukas na lang. Total naman, kamo, magkukonsulta muna kayo sa tandok. Ano? So dati may experience ako doon, nag-doctor to the barrio po ako. Yung ibang mga nakakagat ng aso, nagpupunta sa tandok. Parang basta parang sinisip-sip yung rabies daw doon. So, ako po bilang doktor, hindi ko po yun ina-advise. So, ang ina-advise ko is ang magkaroon tayo ng bakuna laban sa rabies. Next slide. Ayan. So, ang rabies po, kadalasan pinapagsawalang bahala. Pero, ito po ay 100% fatal. So, ito ay talagang nakakamatay. 100% nakakamatay. Pero, 100% rin na po pwedeng maiwasan. So, it is a 100% fatal and 100% preventable. So, paano ba maging responsabling tagapag-alaga ng hayop? So, number 1, pabakunahan yung ating alagang aso. So, sa 3rd month niya, bagong panganak, ika-3rd month, pabakunahan na natin siya. Pwede pong sa ating mga veterinaries o kaya man po sa may mga munisipyo sa department, DA, no, nagbibigay sila ng libreng bakuna or sa barangay nila, nakikipag-coordinate si kapitan sa DA, Department of Agriculture, para magkaroon ng libreng bakuna para mabakunahan ng libre po yung mga alagang hayop or pusa. So, after the 3rd month nung aso, yearly binabakunahan yung ating aso. So, tanong, doktora, pag nabakunahan na ba yung aso ko, hindi na rin ako magpapabakuna. So, kailangan pa rin natin magpabakuna. So, basta pag nakagat po kayo ng aso, ng pusa, nakalmot, kailangan pa rin pong bakunahan. Isa po, wag natin pabayaan na gumagala-gala yung ating mga alaga. So, po pwedeng yung alaga natin, wala namang rabies, kaya lang nakagat siya ng isang hayop na merong rabies. So, maaring magkaroon din po yung ating mga alaga. Pangatlo, bigyan ang alagang aso ng malinis na pagkain, paliguan, at panatilihing malinis ang kanyang tirahan. No? So, para maging hindi lang tayo basta alaga ng alaga, kailangan alam natin yung responsibilities natin sa pag-aalaga. So, kailangan nila ng malinis na pagkain, paliguan, at tirahan. Parang tao din, no? And number 4, alamin ang mga dapat at hindi dapat ibigay na pagkain sa alaga. Ito naman, hindi ibig sabihin na kung ano ang pupwedeng kainin ng tao, ay pupwede na rin kainin ng aso. So, hindi po ganun kagaya ng mga chocolate or ng mga pagkain na may caffeine, hindi yun po pwede sa aso. Pwede kasing magsuka, magtae, mag-seizure at mamatay yung alaga natin. Kagaya din ng mga grapes or yung mga citrus na pagkain at mga raisins, hindi rin yun po pwede sa ating mga alaga kasi pwedeng mag-cause po ng kidney failure. So, pwede tayong mag-search kung ano-ano yung mga pagkain na po pwede sa ating mga alaga at hindi po. So, ang next topic natin ay ang poisoning. No? So, ang poison po ay kahit anong substance na pwedeng mag-cause ng illness or ng death. So, pwedeng magkasakit or mamatay yung isang tao pag nalason. Pag pumasok po sa ating katawan or it comes contact with the skin. No, may routes of entry ang mga poison. So, pwedeng through ingestion, so mainom niya. Pwedeng inhalation, so malanghap po niya. At pwedeng absorption, dumikit po sa ating balat. So, number 1 is yung ingested poisons. Madalas, ito po yung common. Diba, meron tayong mga bote ng 1.5, no? Tapos, pinaglalagyan ng mga gas, ng insecticide, mga ganoon. Tapos, hindi nalilabel, iiwan sa sulok ng cabinet, no? Tapos, kunwari ginamit, pagkagamit, naiwan lang sa lababo. Tapos hindi na alam na pagkamalan na tubig. Kasi clear lang kadalasan yung ibang mga agents no? So clear na inom, akala tubig na inom, ayun, nag-cause na po ng poison. So kaya mag-ingat po tayo dito kung gagamit man tayo ng mga ganitong empty container bottles, make sure na label natin siya properly. So kahit sa pentel pen or masking tape, tapos susulatan natin at make sure natin na nakatago siya sa pinakasulok-sulukan na hindi makikita or mahahawakan ng mga bata sa ating mga bahay, no? So, itong mga ingested poisons, ang example po nito ay mga insecticide, pesticides, kerosene, acids, alcohol, mga gamot, no? So, pwede rin mag-cause ng poison ang mga gamot, poisonous plants, at mga contaminated food and water. So, anong signs and symptoms na may nainom siya na poison? So, po pwedeng magkaroon po ng pagsakit sa tiyan, abdominal pain, cramping. Pwede pong gusto niyang sumuka or nagsusuka na talaga siya. Po pwedeng nagtatae. Po pwedeng nalapnos yung kanyang bibig, or may amoy yung kanyang bibig. Pwede din pong drowsiness, yung parang lasing na siya, tulog ng tulog, or nawala na talaga siya ng malay. At makikita natin, usually, dun sa kung saan natin siya dinatnan, sa paligid niya, nandun din yung poison na nainom niya. Yan. So, anong gagawin natin? Ang number 1 rule is to stay calm. So, kalma lang tayo. Check natin kung conscious yung isang tao. So, kung conscious naman siya, kunin natin agad yung information. Sino ba to? Sino ba tong biktima to? Ilan taon siya? Ano ang kanyang nainom? Kailan? Anong oras? Anong araw? At gaano karami? Yung nainom niyang something. Yung agent, no? So, kung unconscious naman, yung isang pasyente, first natin ito-check is yung airway at yung breathing. Humihinga ba siya? No? Humihinga ba siya? Titignan nyo po yun. So, pwede nyong kapain. Ito, yung dito, tingnan mo. Kung may lumalabas pang hangin, so kung humihinga siya. Kung yes, pwede natin siyang ilagay sa side-lying position. Ito po yung picture na makikita natin sa screen, nakatagilid. So, naka-straight yung isang paa, tapos naka-bend po yung isang paa, kasi mahirap naman humiga kung parehas na legs ay nakadiretso. Tapos yung isang kamay naka-fold, tapos yung isang kamay na diretso lang din po sa floor. So, bakit kailangan natin siya ilagay in a side-lying position? So, kapag hiniga po natin kasi siya ng flat on bed, gravity po, pwedeng yung dila ng isang pasyente humarang doon sa paghinga. So, po pwedeng cause yun na hindi siya makahinga. Pero kapag sinide-lying natin siya, tinagilid natin siya, hindi haharang yung dila doon sa airway. So, importante po na i-side-lying position natin siya. Tapos, itabi natin kung ano yung container na nakita natin within the area, kung ano yung posibleng nainom niya. Para mapag-aralan kung anong klase po yun, lalo na kung wala namang label. And then, tawagan po natin yung Poison Control Center, no? At sundin natin yung instruction na kanilang ibibigay. Kung hindi daw po natin matawagan, pwede na daw nating dalhin yung ating victim to the nearest hospital. So, dito po sa ating slide, nilagay ko po ang number ng ating National Poison Management and Control Center. Sa UP po yan, sa PGH, no? So, pwede po nating i-save itong mga numbers na ito. In case of emergency, pwede natin silang tawagan. So, ano yung mga hindi pala dapat gawin? So, sabi, do not make the victim vomit. So, hindi natin sila pipiliting sumuka. May mga napapanood tayo na kunwari na kainom, sasabihin ng nanay, isuka mo yan, iluwa mo, iluwa mo. So, hindi po dapat ganon. Hindi natin sila dapat papasukahin. Kasi kunwari, nainom na nila yung isang, kunwari, ang kerosene, nainom na po nila. So, nag-damage na yon dun sa lining ng esophagus natin o yung daanan papunta sa tiyan, no? Kapag sinuka pa niya ulit, so babalik ulit niya yun yung kerosene, magkukos pa ng further damage dun sa esophagus. Kaya hindi natin sila pinipilit sumuka. Tapos, do not administer anything by mouth unless na inabisuhan tayo nung poison management control personnel na sige, ito ang ipainom mo or ito. So otherwise, kung walang advice ng isang medical personnel, huwag po nating painumin ng kung ano-ano. So di ba po, pwedeng makuha ang poison through ingestion. Pangalawa, through inhaled poison. So ito po yung smoke or fumes from chemicals and carbon monoxide. So ano ba ang signs and symptoms nito? Pwedeng nausea, so naduduwal-duwal siya. Vomiting, nagsusuka na po. Difficulty of breathing, nahihirapan huminga. Chest pain, masakit ang dibdib. Inuubo, cough, hoarseness, paos, namamaos na. Burning sensation sa lalamunan, so medyo mainit. No? Tapos, pwedeng blue na po ang kulay ng kanilang mga labi o kaya man ng bibig. Pwede rin merong dizziness, nahihilo. Headache, masakit ang ulo, seizure, so nanginginig siya at pwede ring unresponsive na, so unconscious na yung pasyente. So ano ba ang most common inhaled poison? Ito po yung carbon monoxide. No? So ano yung kailangan natin gawin? So number 1 rule is to stay calm at i-ensure natin na safe po yung paligid. No? Kung hindi safe yung paligid, dalhin natin siya sa isang lugar kung saan siya safe. Tapos, tanggalin natin siya dun sa environment na meron. Kasi syempre, kung inhaled yan, so may mga smoke sa isang kwarto, tatanggalin natin siya dun sa kwarto na yun. No? Kasi pag pinabayaan natin siya dun, tas pati ikaw kasama ka, baka yung nag-rescue ay mapahamak din. So, baka dalawa na silang biktima. Imbis na makatulong ka, nakadagdag ka pa, no? So, remove all contaminated clothing from the victim. Tanggalin natin yung damit na po pwedeng kontaminado ng poison. So, siguraduhin lang natin na kapag tinanggal natin yung mga bagay na yon or damit na yon, hindi natin makukontaminate yung sarili natin sa gagawin nating proseso. So, kailangan din po natin ibuksan yung airway. So, kailangan nakakahinga ng fresh air yung ating victim. So, i-check din natin ang kanyang airway, breathing, circulation, humihinga ba siya, no? May pulso ba siya? Ibig sabihin ng may pulso, may circulation doon. So, the next step is to take the victim to the hospital na po. Or kung wala man tayong ma-monitor na airway, hindi siya humihinga, wala kang nakakapang pulso, dalhin nyo na din agad sa ospital. So, ang next natin ay ang absorb poison. So, pwedeng ma-absorb sa ating balat through unbroken skin. Kagaya po ng mga cleansing fluids, mga chemicals, agricultural chemicals, pesticides, industrial products, secretions ng mga poisonous plants. So, ano ang mga signs and symptoms nito? Pwedeng mamula yung balat, magkaroon ng rash, or may blisters yung mamaso, lumubo yung top layer of the skin. So, pwedeng mainit or dry ang balat at dry ang lips. Pwede ring nasunog, yung parte ng balat. Pwedeng may itching, skin irritation, nanlalabo yung paningin, nahihilo, masakit ang ulo, at pwede rin mayroong seizure at unresponsiveness. So, anong dapat natin gawin? Ang number 1 is to stay calm. So, kalma lang ulit. Tapos, tanggalin natin lahat ng contaminants, mula dun sa victim. siguraduhin na pag tinanggal mo yun, hindi mo rin mako-contaminate yung sarili mo. Kunwari, sa isang lugar, yung liquid yung poison, huwag lang tayong basta pahid ng pahid. Kamay natin, ginanon natin, powder, yung makita natin dito, tapos ipapagpag natin mismo ng kamay natin. So, hindi po. Kasi pwedeng ma-injure natin yung sarili natin. So, kung liquid siya, pwedeng kumuha tayo ng tissue or ng pamunas. Tapos, kung ito po yung liquid, tabi lang natin ganun yung tissue para i-absorb niya. So, not necessarily yung kamay natin yung didikit po dun sa poison. Ngayon, kung powder naman siya, i-brush down natin, dun sa balat ng ating victim. Tapos, huhugasan. So, napaka-importante talaga ng tubig. Hugasan natin ng tubig, ng soap, at pwede rin natin sabihin dun sa ating victim kung pwede siyang maligo. At after nun, tsaka natin siya dadalhin sa ospital. So, may mga special considerations po tayo kung may acido or alkaline na napunta sa ating balat or sa ating mata, agad-agad po dapat na patuluan ng tumutulong tubig or yung running water. So, in case of chemical spills po, aalis tayo dun sa area at tatawag tayo sa 911 or sa Bureau of Fire or doon sa ating Poison Management Control Center. Next po nating topic ay ang fire. So, alam natin dapat na ang fire ay mabilis, fast. So, in just 2 minutes, a fire can become life-threatening. In 5 minutes, pwede niya nang kainin ng isang bahay. Ganun siya kabilis. Ganun siya kabilis na maka-cause ng injury. So, fire is dark. So, it produces gases that make you disoriented or drowsy at pwede rin makatulog kayo. So, totoo po yung mga napapanood natin na yung kapag may mga victims, kunwari nasunog yung isang building, nasusuffocate sila. Nakakatulog talaga sila. No? At yun yung kadalasang kinamamatay, yung asphyxiation or yung suffocation. Ito po yung ating leading cause of fire deaths rather than yung nasunog sila. So, thirdly, fire is hot. So, mainit siya. Yung heat at smoke mula dun sa fire ay mas delikado kaysa dun sa flames niya mismo. So, inhaling po yung super hot air, pwede rin makadestroy sa ating mga baga. So, how do we prevent fire? So, kailangan meron tayong proper electrical connections. No? Check by a licensed electrician. So, kagaya po ng nasa picture, iwasan po natin yung mga duktong-duktong na mga, ang tawag dyan. Yan, yung nasa picture, duktong-duktong na ganyan, isang saksakan lang, tapos ang daming na nakakabit, kasi ito po ay pwedeng mag-cause ng mga short circuits at magtuloy-tuloy into fire, into sunog. So, pwede din po natin i-inspect yung mga appliances natin kung loose ba yung cords nila or expire ba yung, exposed yung wire niya mismo. So, pag nga ganun, medyo kailangan na natin pong palitan, para maiwasan ang mga sunog. Thirdly, ito, napaka-common ito. Unplug down natin yung ating mga appliances after use. So, kadalasan, di ba, ito, napaka-common ito, yung cellphone and the charger. So, madalas, charge natin yung cellphone natin. Pagkatapos na mag-charge, kukuha na natin yung cellphone. Tapos, naiwan na lang ng nakasaksak yung charger. Common ito. So, ingat po tayo sa mga ganito, kung lalo na kung may mga bata tayo sa bahay, na pwede nilang masubo yun at habang nakasaksak, makukuryente yung bata. Tapos, itabi daw po natin ang ating mga posporo o yung mga sumasabog na mga bagay, yan, mga flammable liquids, lighters, and other combustible materials away from the reach of children. So, itago natin sila nang hindi nila mapaglaruan. Isa din po, never leave cooking unattended. So, yan, nagsasalang, tapos mapapaupo sa sofa, makanood ng TV, nakalimutan na may nakasalang pala, nasunog na po yung nakasalang. So, buti nga sana kung masusunog lang, pero kung yung bahay natin yung masusunog, no po yun. No? Tapos, do not leave lighted candles, gas lamps, and mosquito coil. So, pag nagkakaroon ng sunog, kadalasan ito yon. May naiwanang kandilang nakasindi. Kung nagbo-brown out naman sa Pilipinas, no, naglagay ng kandila, malapit sa bintana, binuksan ng bintana kasi mainit. Pag brown out, no, hinangin yung kortina, dumikit dun sa kandila, ayun, nag-start na po ng sunog. At yung mga ating katol na naiiwanan po. No? Pangatlo, never smoke in bed. So, para sa mga estudyante natin, no talaga na magsigarilyo. At kahit hindi lang sa estudyante, sa mga magulang din. So, hindi cool ang manigarilyo. No? It is 100% bad for your health. So, walang benefit na maganda na maibibigay ang sigarilyo. So, wag din daw po natin itapon yung mga pinagsigarilyuhan sa mga dried leaves, sa mga basurahan, o mga bagay na po pwede pong umapoy. Maganda rin daw po na meron tayong escape plan, escape routes na i-discuss within the family. Lalo na po kung medyo may kalakihan po yung ating bahay, at least alam natin sa mga plans natin, no, matuturuan natin yung ating mga anak na dito tayo pupunta in case magkaroon ng sunog, no. Kung sarado ito, pwedeng dito ka dumaan, no. Yun po. Next. So, during fire naman tayo, do not panic. So, ayan ulit, kalma lang ulit, paulit-ulit na lang. So, sana matutunan nyo, no, na kumalma ngayong araw na to. So, kung merong sunog, immediately get out of the house. So, umalis na tayo dun sa area na yon at tumawag sa fire department. So, pag umalis daw tayo, kunwari nag-escape tayo, no, maganda daw na kapain natin yung pintuan. Kunwari, nakulong tayo sa bahay, nakasara yung pintuan, bago natin siya buksan, dadamahin natin, kakapain natin, mainit ba siya? Kung mainit siya, malamang kasi may apoy doon. No? So, wag na natin siyang buksan, do not open it, and find another way out. Katulad po ng bintana. Ngayon, kung hindi ka naman makakatakas o makaka-escape dun sa bintanang yon, baka maliit masyado, hindi ka kasya, pwede tayong magsabit ng white sheet or kung ano man merong malaking tela, no, dun sa kwarto, isampay natin dun sa window, galaw-galawin natin para maka-call ng attention. No? Makita nila na, uy, kailangan ng tulong ng bahay na yon. So, ngayon naman, kung ang pinto naman daw ay malamig, no, pwede natin siyang buksan, dahan-dahan. And make sure that the fire or smoke is not blocking. No? So, tandaan po natin na ang hot air or yung smoke po, it goes up yan. Cold air, it goes down. So, yung mga aircon, pag nasa kwarto tayo, may aircon, gusto nyo ng malamig, doon po kayo sa lapag. Doon kasi pumupunta ang cold air sa baba. Pero ang hot air sa taas. Kaya it is important na kapag may sunog, prepared tayong gumapang. No? Kasi pag gumapang tayo, hindi natin malalanghap yung mga smoke na nasa upper portion po, no, ng kwarto. So pag nakaalis na tayo, i-close natin yung door. Yan. So, ayan, maganda nga po na meron tayong escape plan at escape routes. So, matatandaan yan ng mga bata kung na-train natin sila na kapag may sunog, dito tayo pupunta, ganyan. So, magagamit po nila yon in case of fire. Kung magkaroon naman na on the process na palabas ka at nasunog yung parte ng damit mo, no? So, ang gagawin mo, huminto, no? Tapos, drop down at mag-roll. So, mag-roll tayo hanggang matanggal yung apoy. Yun yung way ng pagpatay sa apoy, hindi yung ganon. Hindi po ganon, no? So, stop, drop, and then roll para po mamatay siya. At pag nakalabas na daw tayo sa isang lumiliyab na building or sa ating bahay, stay out na daw. So, do not go back inside for any reason. Get out and stay out. Kagaya po ng nasa picture. So, pasok lang daw po tayo dun sa bahay or dun sa building kapag sinabi na nung fire department or kinlear na nila na okay na, safe nang pumasok sa loob. At kung tayo naman daw ay merong burn injuries or nasunog yung parte ng katawan natin, pumunta daw tayo sa ating health facility. Next po is ang ating burn. So, kung may fire, malamang pwedeng magkaroon ng burn. So, ano ba ang burn? Ito ay resulta ng direktang contact sa heat energy. So, pag sinabi nating burn, meron siyang causes of burn at merong depths of burn. No? So, pag sinabi nating causes of burn, yan yung thermal burn, electrical burn, at chemical burn. Pag sinabi nating depth o yung lalim ng sunog, yan yung 1st degree, 2nd degree, 3rd degree, at 4th degree. So, dito muna tayo sa ating thermal burn. So, ito ang most common, no? So, ito, ang example ng ating thermal burn, no, ay sun exposure, pwedeng may contact with fire, pwedeng very hot objects, liquids or gases, or yung mga blasts, yung mga pagsabog. So, kung nakikita nating picture dito sa ating screen, ito po yung bata na natapunan ng mainit na tubig. Ayun, so merong contact with very hot object, kaya nalapnos yung kanyang balat. Ganon din po dito sa ating isang picture. Ang difference lang nila, ito, nalinis na to, natanggal na yung mga blisters. Ito po ang blisters. So, yan ay hindi pinuputok. Okay? Kung hindi po tayo medical personnel, wag po natin putukin kasi baka mas lalong ma-infect yung pasyente. So, another cause of burn po ay ang ating electrical burn. So, ito naman daw yung may direct contact sa mga live electrical currents or yung lightning katulad po ng kidlat. Next po is ang ating chemical burn. Ito naman yung direct contact with a corrosive substance. So, pwedeng yung substance na to ay solid, pwedeng liquid, or pwedeng gas. So, ang pwedeng mangyari, ganyan po, parang nalapnos yung balat. Ayan, nagkaroon po ng blisters, no, lumobo siya. Yan. Ito naman po ay batang nagpahena, tapos nagkaroon siya ng irritation dun sa substance ng henna. Kaya, ayan po, nasunog. So, markang-marka yung design ng henna. So, ingat tayo pag nagpahena tayo. Ayan. Pag sinabi din naman po natin depth of burn, di ba? Katulad po ng nasabi ko kanina, ito yung 1st, 2nd, 3rd, and 4th degree burn. So, ang pinaka-common po, itong 1st degree burns, no? Ang ina-affect lang nito ay yung ating top layer ng skin, which is the epidermis. So, dahil ito ay mababaw lang, superficial siya, ito yung pinaka-common. No? Ang pinaka-common na 1st degree burn ay ang sunburn. So, halos lahat tayo naka-experience na nito. No? Ito ay mapula, masakit, no? Wala siyang blisters, pero pwede siyang mamaga. So, ang 2nd degree burn naman po, syempre, 2nd degree, no? Ma-affect niya yung 2nd layer of the skin. Ito yung epidermis at saka yung dermis. Pero ito, hindi niya sinisira yung buong thickness ng skin. So, ang itsura nito ay moist, mamasama-sa, mapula, namamaga, merong blisters, yung lumobo na nga, at saka ito po yung very painful. So, masakit na masakit itong second degree burns. Ang first at second degree burn ang masakit. No? Pagdating sa third degree burn, so medyo malalim na to, ang apektadong parte na po nito ay ang epidermis, dermis, at subcutaneous layer. So, kagaya po ng nasa picture, pwedeng dry na siya, leathery, manhid na yan. So, hindi na siya masakit. Hindi na siya nakakaramdam ng sakit dyan. Kasi yung mga pain receptors natin sa ating balat, no, na-damage na, kaya wala na siyang pain na nararamdaman. At pwedeng dark brown at charred yung itsura niya. Ang fourth degree naman, ang kinaibahan ng third degree at fourth degree, ito, dahil lahat na ng layers din ay affected, yung epidermis, dermis, at subcutaneous layer natin, pwedeng involved na rin ang fats, muscles, at ang bones. No? So, it extends to all the layers of the skin. So, ito po ay no pain, no? Pwedeng matigas na rin yung area ng nasunog at hindi siya nag-heal on its own. So, hindi siya, kailangan kadalasan ng ganito is ma-confine na sa ospital. Kasi deeper na yung infection. No? Ang kadalasan ng ating mga burn patients, namamatay pwedeng sa dehydration, lalo na kung halos buong katawan niya na yung apektado. So, pwedeng mamatay siya hindi naman dahil sa sakit or sa kirot, pwedeng sa dehydration or sa infection. Ayan po. So, itong picture na to, ito yung epidermis, yung top layer. So, ito yung first degree burn, yung top lang yung affected. Sa second degree burn, ito yung epidermis, tapos yung second layer ay ang ating dermis. So, ito po yung ating second degree burn kasi dalawang layer na yung affected. Pag third, ibig sabihin yung epidermis, dermis, at yung subcutaneous layer, lahat siya ay affected kaya third degree burn. No? So, pag fourth, kasama na yung muscle, yung fats, yung bones, yun po. So, pag may nakita kayong nasunog, baka ma-identify nyo na, ay, first degree burn yan. Ay, no, hindi. Second degree burn yan. Pwede na po kayong mag-doktor. Okay? So, paano ang ating first aid? Pag mga first, second degree burn, pwede tayong magbigay ng first aid treatment. Pero pag mga third and fourth, dalhin na natin siya sa ospital para mabigyan ng karampatang lunas, no? So, ang number one rule natin, pag may burn, nasunog, kalma lang. Tapos, quickly remove the victim from the source. So, tanggalin din natin yung damit niya or kung ano mang meron doon sa nasunog na area. Except lang kung nakadikit na po yung damit doon sa nasunog na parte ng katawan. So, kunwari napaso tayo, hindi naman kalakihan, no? Wash natin with water. So, pwede natin siyang hugasan kasi marirelieve agad yung pasyente kapag nagkaroon ng pag nahugasan natin siya ng tubig. Pagkatapos hugasan, pwede natin punasan at kung meron po tayong ointment, ang burn ointment na madalas po natin ginagamit ay yung silver sulfadiazine. So maganda rin sana kung meron tayong ganito sa bahay. No? Kung wala naman tayong ointment na silver sulfadiazine at meron tayong aloe vera na tanim sa bahay, so maganda rin itong aloe vera para pangtanggal ng sakit. No? So, initial first aid treatment din itong aloe vera. So, sabi, do not prick blisters. So, yung lumobo, wag daw natin siyang puputukin. Mga medical person lang ang pwedeng pumutok po yun. Kasi po pwedeng lalong ma-infect, no, yung sugat. Next, do not apply ice. So, wag daw yellow ang ilagay natin. So, imbis na yellow, tubig na lang, hugasan mo, tapos lagay agad ng silver sulfadiazine. Kung sobrang laki naman nung area na nasunog, hugasan natin, lagyan ng ointment at dalhin sa health center or dun sa health facility. No? Kung walang silver sulfadiazine, hugasan, tapos tsaka dalhin sa health facility. Huwag na natin siyang pahiran ng mga, ano bang common na ginagamit? Toothpaste. Yan. Kasi malamig, no? So, malamig yung feeling ng toothpaste, kala nila okay lang yun. So, hindi po. Hindi natin siya papahiran ng toothpaste, hindi natin siya papahira ng mga langis, ano. So, kung magpapahid lang kayo, yung silver sulfadiazine na yung gamitin natin. Okay? Kasi pag mga langis-langis pa, lalo pang mairita yung balat ng patient natin. Kapag naman daw for chemical burns, no? So, chemical, whether wet or dry, so kalma lang po ulit. Tanggalin natin yung biktima dun sa environment, dun sa source, no? Blot off natin or i-brush off yung chemical mula dun sa balat. So, not necessarily yung kamay natin yung gagamitin natin. So, gagamit tayo ng ibang gamit para matanggal natin yung chemical na yun. And then, flush with water. So, very important, wash with water. Running water for at least 20 minutes para talagang matanggal yung chemical. Tapos, do not apply anything at dalhin na natin siya sa healthcare facility. Ganun din po pag sa mga electrical burns, no? Tanggalin natin siya ulit dun sa source, no? Huwag tayong mag-apply ng kung ano-ano at dalhin na natin siya sa healthcare facility. Kadalasan kasi ng mga chemical burns at yung mga second and third and fourth degree burns, medyo malala na siya. So, kailangan na nating pumunta sa ospital kasi kailangan na rin mabigyan ng antibiotic yung pasyente. Kasi pwedeng sa infection naman siya madali. Okay? So, I think ito po, second to the last topic natin, ang wounds. So, very common ito. So, ang wounds po ay mga common injuries sa balat at sa mga tissue na po pwedeng nangyari dahil nagkaroon ng exposure sa external forces. So, ang wound, dalawa lang yan. It's either closed or open, no? Pag closed wound, so, syempre, close nga siya at intact yung skin ng isang tao. Ang damage niya ay nasa ilalim ng skin. So, pwedeng sa mga tissues, kagaya po ng picture na nakikita ninyo sa screen, no? Pwedeng, sa umpisa naman ng pasa, hindi siya agad violet. So, pwedeng mapula lang siya, no? So, may redness, pwedeng mamaga siya, no? Tapos later on, mag-violet na siya. Yung hematoma. Tapos, kung sobrang laki talaga nung pagpapasa, pwedeng may internal bleeding na doon. No? So, ito po ay example ng isang closed wound. So, ano ang dapat nating gawin kapag nagkaroon ng closed wound? Kagaya niyan, no? So, immediately, lagay po tayo ng cold compress. So, malamig siya. Tandaan natin, cold muna. Malamig muna yung unang ilalagay. So, lagyan na agad ng cold compress, no? Every 2 to 3 hours sa unang 24 oras, magko-cold compress po tayo. Tapos, after nung 24 hours na yon na cold, ang susunod na po natin ilalagay ay yung hot. No? So, ang cold, iniiwasan niya na mas magpasa pa siya, na mas mag-swell, mas bumukol pa siya. Sunod na nga, after the cold is yung hot. Ano po? Mag-hot compress po tayo, 15 minutes, 3 times a day, sa second day na po. Kung may closed wound, ang second type natin ng mga wound ay yung open. So, ito na yung medyo madami. So, syempre, open, broken yung skin surface niya. So, pwedeng abrasion, laceration, incision, puncture, amputation, or avulsion. So, kung abrasion, ito po yung galos o yung gasgas, pinaka-common to, no? it affects only the top layer of the skin. So, hugasan natin yung sugat immediately with soap and water. Tapos, pwede tayong mag-apply ng mga antiseptic solution, kagaya ng mga alcohol or betadine, no? And then, after nun, pagtuyo na niya, tsaka tayo mag-apply ng mupirocin ointment. Ang mupirocin ointment po ay antibacterial ointment, no? Para mas mabilis gumaling yung sugat. So, mas maganda kapag mga galos o gasgas ay hindi natin siya tatakpan para mas madali pong matuyo. So, ito yung example ng mga galos. Next ay ang ating laceration o yung punit. Kadalasan ito ay nag-cause na pag tumama tayo sa mga blunt objects kagaya ng bato o ng kahoy or something na matigas. Pero hindi sharp, no? So matigas lang siya. So kapag nagkaroon ng laceration o punit sa balat, number 1 na gagawin is yung hugasan ng malinis na tubig. So wash natin siya, running water, Tapos, iko-control natin yung pagdudugo. So, tandaan natin, parate, pag may bleeding, iko-control dapat yung bleeding. So, kailangan ma-stop natin yung bleeding. Kung kunwari, ang kagaya po nung nasa screen natin, dito yung sugat niya. Pag naglagay tayo ng pressure dito, no? Dito sa mas mataas na portion, pag dyan tayo naglagay ng pressure, makakatulong po yan para huminto yung pagdudugo. So, kunwari dito nga yung sugat, no? Dito tayo mag-a-apply ng pressure. Hindi dito. Dito. Siyempre, pag ganito yung blood flow, lalabas lang yung dugo. Pag dito tayo naglagay ng pressure. Pero pag dito tayo naglagay ng pressure, pag ganun yung blood flow, so dito, mas-stop na, no? Kung hindi naman gaanong kalaki. Kasi kapag naman, syempre yung severity po ng sugat, kapag malaki talaga siya, ang tendency, malakas siya magdugo. Pero kung hindi kalakihan, hindi naman ganun kalakas magdugo. Pero pag nag-apply tayo ng pressure, matutulungan natin na ma-stop agad yung bleeding. So pag nag-apply tayo ng pressure, after natin hugasan, pwede tayong maglagay ng mga antiseptic solution niya, kagaya ng betadine and alcohol, and then after that, yung ating ointment. Kapag naman sobrang nag-apply na tayong pressure, hindi tumitigil ang pagdudugo, that's the time na kailangan din natin silang dalhin sa healthcare facility. Ito pong picture na nandito, medyo malaki na to, no? So, medyo matagal to magbi-bleed. At pangit din kung hindi natin siya dadalhin sa ospital or sa healthcare facility. Sa mga ganitong klaseng sugat po, medyo malalaking laceration, maganda po dito, tinatahi na. Kasi, pag tinahi natin siya, unang-una, maganda yung wound healing. So, maganda yung mabilis siya gagaling, tapos hindi nakabuka. Kadalasan kasi yung mga nakikiloid, yung mga hindi natatahi. Pero pag pinagdikit po yan, kapag tinahi, no, maganda ang wound healing yan at mas mabilis siyang gagaling. Ganon din po dito sa incision or yung hiwa. Kapag sinabi natin incision, ang cut nito ay galing sa sharp na object. Kung ang laceration, blunt object, so matigas lang pero hindi siya sharp, sa incision, sharp po siya. So, pwedeng, kagaya nitong nasa picture, no, mas malinis yung hiwa niya kaysa sa laceration. Kasi nga, matalim yung nakasugat sa kanya, pwedeng blade, pwedeng glass, no? Ayun yung mga po pwedeng mag-cause ng incision. So, pag may mga ganyan, no, wash agad natin with water and then control the bleeding na, no? So, didiinan natin para mag-stop yung bleeding. Pag nag-stop, lagay na tayo ng antiseptic solution such as betadine and alcohol. And then, kung meron tayong mupirocin ointment sa bahay, which is yung antibacterial ointment natin, maganda na lagyan natin siya. Pwede na tayong maglagay ng mga ointment, mga every 4 hours kasi lalo na kung nasa exposed areas, mabilis matanggal yung ointment. So, pwede every 4 hours magpapahid tayo ng ointment. Just make sure na pag nagpahid po tayo ng ointment, nalinis natin yung sugat. Pero kung tuloy-tuloy pa rin yung pagdudugo, no, dalhin pa rin natin siya sa ospital. Kagaya po nitong mga nasa picture, medyo malalaki na po yan, better pa rin na matahi siya para mas mabilis gumaling at mas maganda yung wound healing niya. So next po ay yung puncture o yung tusok, no? Pwede naman ang tusok kasi ay sharp din at pointed object ang nag-cause niya. So kunwari natusok tayo, pwede namang, ayan, katulad po ng nasa picture, pako, pwede rin namang maliliit kagaya ng mga karayom, di ba? Punctured pa rin naman siya. So tusok siya. Ang gagawin natin, kung kunwari maliit lang yung nakatusok sa atin, tanggalin natin. No? Pero kung yung malalaki, kagaya nitong nasa picture na pako talaga, no, hindi natin siya tatanggalin. Hayaan lang natin siya, huhugasan lang natin ng tubig, buhusan natin ng betadine or ng alcohol, and then dalhin na natin sila sa healthcare facility. Kasi kapag tinanggal natin to, no, so pwedeng pagtingin mo ng ganyan, ang reaksyon ng tao, hugutin mo. So, hindi po natin hinuhugot yan kasi pwedeng in the process na paghugot natin, mas ma-injure natin yung tissues at yung mga blood vessel, no? So, mas magkukos pa ng injury. Hayaan natin yung mga medical personnel ang gumawa po noon. So, next is yung amputation. So, putol. Kagaya po nitong nasa picture, no? Medyo morbid yung ating picture, pero isa itong perfect example ng amputation. So, una, i-control natin yung bleeding, katulad yan sa kamay, no? So, again, pag dito dyan yung naputol, ang pressure natin dito sa mas mataas na portion. Ano po, pwede nating talian, apply tourniquet para ma-minimize natin yung bleeding, no? Tapos ngayon, yung naputol na part, hindi natin yan itatapon. Kasi, lalo na kung agad-agad nakita mo ito yung naputol na part, pwede kasi pa yan iduktong. No? So, ang gagawin natin, ilalagay natin siya sa moist dressing. So, kumuha ka ng tela, basain mo, ibalot mo yung naputol na part, tapos ilagay mo siya sa plastic, at saka mo ilagay sa yelo. Tapos dadalhin mo yun, pati yung biktima, sa health center, sa health center or sa hospital, para mabigyan siya ng karampatang lunas. So, yung mga ganyan, may mga incident po na ikakabit pa naman. Pero kung masyado nang matagal, yung sa timing, pwede rin po na hindi na. So, putol na talaga siya. Pero may mga chances po na kung madadala natin agad sa ospital, na iduduktong pa po yan ng mga surgeons. And ito pong avulsion o yung tuklap, kadalasan ito yung mga sumabog, naputukan, yan yung avulsion. Huhugasan ulit natin ng tubig and then apply pressure para ma-minimize yung bleeding at dalhin na natin sa isang healthcare facility. So, wag naman sana yung mga ganyaang insidente. Medyo nakakatakot na. Pero kahit nakakita na kayong ganyan, number 1 rule natin is to stay calm. So, kalma lang. Okay? Kalma lang tayo. Ayan. So, ito na po yung ating last topic for this afternoon po is yung hand-only cardiopulmonary resuscitation. So, pag sinabing hands only, di malamang kamay lang yon, di ba? Na CPR. So, hindi tayo gagamit dito ng mouth to mouth, hindi po, kundi mga kamay lang. So, ito po ay isang life-saving technique and useful sa mga emergencies. So, chest compression only, cardiopulmonary resuscitation should be provided rather than no attempt. So, mas maganda daw na gawin natin ito dahil simple nga lang siya kaysa hayaan lang natin na wala tayong ginagawa dun sa isang pasyente na nakita natin na biglang nawala ng malay o biglang bumaksak. So, pag sinabing chest compression only CPR or hands only CPR, parehas lang po ang ibig sabihin yan. No? Na chest compression, gagamitan po ng kamay. So, meron pong dalawang step yan. Number 1 is to call for help, call for ambulance, call 911. No? So, call for help. Damayan na yan. No? Huwag mong sarilihin ang problema. No? Humingi ka ng tulong. And number 2, push hard and fast. So, gagamit tayo ng dalawang kamay natin. No? Nakaganoon. Tapos, hard and fast. So, makikita natin dito sa picture, nakalagay, push hard and fast about twice every second. So, makikita natin siya. Ito po yung ating sternum, yung buto. So, sa pagitan ng dalawang nipples, yung gitna po nun, doon yung ideal area kung saan tayo gagawa ng CPR. So, dalawa lang yan. Call for help and then do the compression hard and fast. So, for the specific details, ito po, kung ano yung mga dapat nating gawin. So, what to do if a patient suddenly drops unconscious or is seen unconscious? So, una ulit, kalma lang. Relax lang tayo. Tignan natin yung paligid kung safe ba na gumawa ng hands-only CPR. So, ito-check natin kung responsive ba yung victim. Kapag unresponsive siya, no, ihihiga natin siya, kagaya po nung nasa picture, ng flat on his back. No? Tapos sunod, call for help. Activate the emergency medical services or call for ambulance or a doctor. Pag nakatawag na po kayo, pwede na po kayong lumuhod sa tabi ng pasyente and then start the chest compressions. So, kung makikita po natin, sabi, place the heel of your hand. So, hindi itong palm, hindi ito yung, hindi yan yung buong palm yung ididiin mo sa dibdib. So, heel lang daw. Ito daw po. Ito yung heel ng ating palm, no? Yung heel ng ating palm, yun yung ididikit natin sa gitna ng dibdib. Tapos, gagamitan natin ng walang chest compression na isang kamay lang. Dalawa pong kamay yung ginagamit. No? So, ito, i-overlap natin, ganyan. Tapos, ito yung papatamain natin dun sa chest. Sa gitna, no, in between the nipple, yung gitna, yung po yung dun tayo gagawa ng chest compression. So, put other hand on top of the first with your finger interlaced. So, ganun nga po, i-interlace natin. Tapos, ito yung tatama. Press down and compress the chest. No? Keep your arms straight. Kagaya po nung nandito sa picture, ayan, straight yung kanyang arm. Hindi mo siya ibibend habang gumagawa ka ng chest compression. Diretso lang siya. And push down with your arms and hands and allow complete chest recoil after each compression. So, dun sa video na nakalink din po dito, makikita natin, no? So, ano ba, the demo. Kung diretso siya, so ito, yung ating heel ng hand, tas kamay, diretso po yan. Diretso po yung kamay ninyo. Ganon. Hindi siya yung ganito. Hindi siya ganyan. Diretso. Yaon. So, sana po nakita ninyo. And then, compress continuously with both hands at a rate of 100 to 120 per minute. So, kung yung dalawa per second, makakabuo tayo ng 100 to 120 per minute. So, tuloy-tuloy lang ganun. Puro chest compression hanggang dumating yung ambulansya. Ano po? So, every minute, CPR is delayed, a victim's chance of survival decreases by 10%. So, isipin mo, ganun siya ka-importante. Isang minuto lang na hindi mo na CPR agad, yung isang pasyente na tumumba or nag-collapse, meron na agad siyang 10% na chance na hindi makasurvive, no? So, immediate CPR from someone nearby can double or even triple their chances of survival. So para sa mga estudyante, no, mga kasama sa bahay, no, hindi naman mga medical professionals, malaking bagay po itong hands-only CPR. Sana nga, kung may natutunan kayo, sana meron. So keep calm and hope you learned something. So marami pong salamat. I hope na everybody would be safe po. Thank you.
Thank you so much, Dr. Ann Isabel Gonzalez Andres, sa pagbabahagi ng mga bagay na kailangan naming malaman tungkol sa first aid.
Unang araw pa lang ng selebrasyon natin ng OK sa DepEd na may temang Bayanihan para sa Kalusugan, OK sa DepEd sa Paaralan at sa Tahanan ay busog na tayo sa kaalamang medikal na napapanahon ngayong pandemya.
Natunghayan natin ang 6 na flagship program na ipinatutupad sa bawat paaralan natin dito sa Schools Division of Imus City.
Kasama na rin dito ang inauguration ng 2 Central School Clinic na tutugon sa pangangailangang medikal at dental ng mga mag-aaral ng Imus.
Ang innovation pagdating sa medical and dental services tulad ng telemedicine at teledentistry ay nakakatulong upang patuloy na makapagbigay ng serbisyo sa panahon ng pandemya.
Tumutok tayong muli bukas para sa iba pang mahahalagang programa ng OK sa DepEd. Once again, ako si Darwin L. Kamama.
At ako naman po si Lenny Paarde,
ang inyong mga MC for today. Magandang buhay!
Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. School-based feeding program ating pagtibayin. Wastong pagkain ating ihahain, mga batang kulang sa timbang. Ating pakakainin ng Go, Grow, and Glow. Adolescent reproductive health ay gawing gabay at patnubay ng batang mausisa ay di maranasan. Ang early pregnancy ay maiiwasan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. National Drug Education Program or NDE kung tawagin. Ito'y paigtingin, mga bisyo'y alisin. Sigarilyo at droga'y dapat nang buksain. Water sanitation and hygiene in schools ating kompletuhin, 3 stars ay abutin. Malinis na tubig, segregated na toilet, group hand washing at may napkin na rin. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay, Oplan Kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Medical, dental, and nursing services na atin ding binibigay upang matugunan problemang pangkalusugan ng mga guro at kabataan. kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo sumama. Tara na okay, Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay, Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay, Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Okay talaga sa DepEd. Okay talaga sa DepEd.